Hello, everyone. My name is Dr. Rakesh Gopinathannair. I'm a cardiac electrophysiologist at the Kansas City Heart Rhythm Institute and professor of medicine at the University of Missouri, Columbia. Thank you for the opportunity to introduce the latest scientific statement from the American Heart Association on cardiac arrhythmias and autonomic dysfunction in COVID-19. The first part discusses the pathophysiological mechanisms that underlie arrhythmic manifestations in patients with COVID-19. A lot of different mechanisms have been postulated, including direct viral entry, myocardial inflammation, critical illness related release of cytokines, and overall the acuity of illness and patient factors among those. In fact, several of the specific mechanisms still remain elusive, and there's definitely a patient factor, there's definitely a direct COVID infection, and also the underlying acuity of illness all contribute to some of the arrhythmic manifestations. And we detail the available data on pathophysiological manifestations, and we also acknowledge that we still need to learn a lot about this. We then discuss various arrhythmic manifestations. We start with the bradyarrhythmias, and then we move on to one of the common manifestations that has happened, including atrial arrhythmias, especially atrial fibrillation and atrial flutter. And one of the interesting studies was to look at whether how COVID-19 compared with the flu in terms of its impact on atrial fibrillation and survival. This study showed that, in fact, the incidence of atrial fibrillation and flutter was pretty similar with COVID-19 compared to those in the flu season. And so it may not be a specific viral component, but it could be in general the catecholamine release as well as the acute illness factor associated with this disease.